Usually, the quick way of finding out what kidney function is to take a blood sample and look for the products of metabolism within the blood plasma and calculate roughly what the kidneys are doing in the body. This is a very practical way of measuring kidney function, but it's also very inaccurate and can change from day to day more so than the actual kidney function does, and it can also lie to you and mislead you. When the patient is very sick, it may tell you the patient is normal, or the patient may be perfectly well and your result comes back abnormal. The more detailed way of measuring kidney function is to administer a radioactive tracer and then to take 16 samples over 24 hours. Now, naturally, if you're a mother and your child has to undergo a procedure like this, you will find it somewhat daunting because of the 16 blood samples. So what we're working on is a way that is as accurate as taking 16 blood samples and as precise, but takes more blood samples and also uses a radioactive tracer. So we have worked out to take 4 blood samples over 4 hours, which is darn sight fewer than is done now for the standard, gold standard type techniques used to determine kidney function. Now, the use for this is that it's much more clinically practical to be able to do it in a shorter period of time. That's one. And secondarily, if patients have acute illness or chronic illness, it gives you a faster answer with less effort and an accurate answer so that you're not fooled by what otherwise might be very misleading results. We expect, therefore, that this will be used for patients who are in the ICU, for patients who are post-surgical, and numerous patients who cannot currently be analyzed properly. The technique that we're using is not very different than what is currently being done. Currently, one administers a small amount of radiotracer and takes samples at 2, 3, and 4 hours, and then one uses a model to figure out what kidney function is. Unfortunately, the models don't work very well and fall apart when patients have difficulties with their body fluids, when they're acutely ill, and so on. What we are doing is taking 4 blood samples over 4 hours at 5 minutes, 20 minutes, an hour, and 4 hours. So it's only slightly different than what's being done currently, for the most part, in Canada. The advantage is that it's not, it's much more robust. We're using this clinically in the General Hospital in St. John's in Newfoundland, and it's being used at the Roswell Park Memorial Institute in Buffalo for routine patient care. However, it hasn't caught on in a big way yet, and we're now analyzing retrospectively lots of data, hundreds and hundreds of cases that have been very difficult to analyze with prior techniques, which is why we have so much data from around the world, particularly from the United Kingdom. We have many hundreds of cases, and we're analyzing that data. It looks very, very good. And it looks like it may, at least it has a chance of replacing the more common techniques, the better known techniques, because of the quality of the results and the applicability to all sorts of disease states which are invisible now to current testing, and because the model avoids some of the pitfalls that are now problematic.